welcome to the newest episode of the Beyond the Books Real Talk with Student Nurses podcast. I am your host, William Souza, and we are here joined by our special guest, the Dean of the School of Nursing and Health Professions at the University of San Francisco, Dr. Eileen Frey-Bowers. Thank you so much for joining us today.
Hi, Will. So happy to be here.
So I just want you to go ahead and share a little bit about your career journey. What brought you to USF, and what are some goals you have for the nursing program here at USF?
Oh, you're going to make me out my age. I started out my career in the clinical space, working in adult ICU and in the United States Navy Nurse Corps. And along the way, I figured out that what I really loved was pediatric ICU. And so I focused on that for a few years, went back to grad school, became a pediatric nurse practitioner and clinical nurse specialist, and did that for a while. And I was really excited about children's health care and advocacy, which led me to law school, which then led me to getting my PhD, which then led me into the academic space. And so for the last, 2 decades, I've been working at the university level on nursing education and policy and advocacy. I've had the opportunity to be on faculty at schools of medicine, public health, nursing. Nursing's always my favorite. And I've, just really developed a just strong desire to ensure that we are preparing in the best way possible a nursing workforce that is future ready. And future ready to provide care, but also future ready to lead in the healthcare space. Nurses make up the largest number of healthcare providers in the nation, but we also do that across the world as well. So when you think about the spaces that nurses are in, we are in not just acute care settings. We are not just in the community. We are in schools. We are in nursing homes. We are in insurance companies. We are in pharmaceutical companies. There are a lot of places that nurses can share their perspective and lead. And so that's really what I want to bring to USF is an opportunity for our students to see the possibilities for their career, to see places where they can go, whether it's caring for, individuals on the street who are unhoused and struggling with substance use disorder, whether it's taking care of the sickest infant in a neonatal ICU, whether it's working in the community-based setting, providing health education. I want each of our graduates to be as prepared as possible with all of the technical skills and the professional skills of nursing, but also the leadership skills so they are empowered that when they see something that's not working right for our patients, their community, or for our profession, that they have the skill to be able to go in and figure out a way to solve that problem.
Oh, that is really great. It is an inspiration seeing that vision. So thank you so much for sharing that with us. And in this episode, we actually have 5 other nursing students who will be interviewing you today. They are all part of the Junior 2 nursing cohort, so that means they are in their advanced med-surg rotation. So stay tuned. We're going to have our students each come in one by one, and they're going to go in and ask you a question.
I look forward to it.
Hi, Dean Eileen.
Hi, Alex.
As you know, I'm passionate about mental health, so my question is, nursing can be very stressful for both students and professionals, and as a leader yourself, how do you manage stress and avoid burnout, and what advice do you give for future nurses?
Thanks, Alex, for such an important question. As we went through COVID, we really were able to shine a light on the need for nurses to provide self-care because of the fact that that it is such a stress-inducing profession. I think it really starts in your nursing education, figuring out ways to relax and handle your stress during school, right? So get yourself into a habit of whatever it requires to sort of let go of your studies, let go of the moment that you're facing, a test or your clinical experience at the time, and find something that fills you up in a different way. I think generating those habits early in your career, starting with your nursing education, is really important. Obviously, as your roles change in life, as you take on new and different jobs, you're going to have to find different ways of stress reduction. Sometimes you don't have as much time for yourself, but being able to find something that fills you up and then set aside and be intentional about doing that. We talk about hobbies, things like that. But today, the in thing is then to do it on TikTok and monetize it. Do it for yourself. Find something that doesn't need to be monetized, that just fills you up, whether it be gardening, whether it be reading, whether it be exercise, listening to music, taking a walk, in the evening after dinner, all of these things, putting something structurally into your day is really, really important. I'm a big Peloton devotee, so I really like to get on the bike and just stomp out the stress that I'm experiencing. I love to get lost in a really good book, where there's rich characters and I can leave the outside world, and those are things that work for me. Journaling works for some other folks, but it's really about finding something that works for you and doing it and holding yourself to doing it.
Yeah, I like that. You have to prioritize yourself sometimes. I'm a big journaler.
Good.
It was really nice talking to you and meeting you, and I hope you have a good rest of your day.
Thanks, Alex.
Hello, Dean Browers. My name is Sarai Hernandez, and I am interested in community health nursing. My question for you: a lot of students in our cohort are familiar with the metaphor nurses eat their young. What do you think nurse leaders are obligated and responsible to do to counter this work culture? And what do you think those same nurse leaders are lacking when the situation isn't improving?
Wow, such a tough question. I'm sad to say that when I was a nursing student and a young nurse, I heard the very same phrase. So, clearly the fact that that phrase is still out there means that we as a profession have not done what we need to do. I think there are a lot of things that contribute to it. Nursing has not, as a profession, received the support and recognition that it has deserved. And I think sometimes that feeds into feelings of powerlessness. And when you can't take it out on the structures, you take it out on each other. And, it's really unfortunate, and it's devastating to our profession, right? Because new nurses are most apt to leave the profession between that 3 to 5, 7 year mark. So, we really need to do something about it to ensure that people can have longevity in this profession. I think a lot of it comes down to communication. In our nursing programs, we always talk about communication and teach communication skills for patients and for families, how the nurse is going to interact with them. Or maybe, communication skills around working with other professionals like physicians or other healthcare providers. I don't think we spend enough time on communication with one another within the context of a day-to-day shift, a day-to-day working environment. We don't spend enough time on conflict resolution, conflict recognition and conflict resolution. I think, and the other thing that we need to recognize is that currently in the workforce, we've got 4 generations of people working together. And in nursing, that's tough because you have a lot of individuals working who were taught a certain way and want to continue to practice in that way, when we know that's not the best for the profession and for our newer nurses. And our newer nurses are hopefully being taught about communication and conflict resolution. I think, each situation is going to be different. The environment that you're working in and the supports that the leaders have in those environments, but working on things that improve communication, whether that is, more education, setting up opportunities for folks to come together and talk on a regular basis, practicing shared governance where everybody's voice counts on a unit. Those kinds of things can go a long way. And I think one of the things that we're trying to do at USF is really pay very close attention to this by leaning into our Jesuit values and really leverage those in the classroom so that our student and in the clinical setting so that our students are prepared to deal with some of these things in a more self-sustaining and resilient way to make good change, to be a role model. And of course, I think leaders need to be the role model as well.
Yeah. Well, thank you so much for talking with me. I appreciate your answer.
Really appreciate the question. Such an important issue.
Hi, my name is Maya Ortiz, and I'm interested in the ICU. So as Dean, part of your role includes overseeing funding allocation and advocating for our program at the university level. Could you share how decisions are made around allocating resources while ensuring students' voices are prioritized in this conversation?
So that's not a softball question at all.
I figured I have one chance to talk with you. I might as well ask my big one.
Yeah. So financing in higher ed is really complicated, especially right now, with changes from the federal administration and issues at the state level. So there's a lot of things that go into the budget process at a university. As a dean, I look at a couple of different things. One, I have to look at what we have to contribute to the university. We call this our contribution margin, and that is meant to our sort of what we give to the university to maintain things like the library, the correct health center, the grounds, the food, all of the things that go into a university that are services that, we have to pay for that because our students use those services. So that's a portion of, what I have to consider. Then I have to consider things like faculty and staff support for running the programs. What is it going to take to be able to make sure that we've got a faculty member in the classroom, and then I have to think about how many students we can bring in. And the number of students that we can bring in, because we are a professional program, that is regulated by the Board of Registered Nursing for the nursing students. They limit how many students we can bring in for both our registered nursing and our nurse practitioner programs. And then we have accrediting bodies that we have to answer to. And so we've got to find a balance between the number of students and the number of faculty and so forth. So it's really about a balancing process, looking about, it's like any budget, what comes in and what needs to go out, right? I think with regards to the student voice, I think I'm always trying to listen to the students. We have, ask the dean questions. I've had, dialogue with the dean where we've had open forums. I've had other kinds of engagement processes that, allow students to share things. And then, of course, I communicate with many students just via email. They ask questions. I'm always thinking about the costs of education and how we can make it a good value for our students, and really trying to limit the amount of debt that our students take on in trying to get this really good education. So always trying to think about, fees. Is there a way that we can reduce those fees? Is there a way that we can make sure that we're getting a better price for something that we need? Those kinds of things. It really is a complicated process in terms of the number of things that we have to consider, but the basics are there. You only bring in a certain amount of money and you have a certain amount of costs that you have to address in order to provide our students with the resources and things that they need to be successful in their education and then be able to go on pass the NCLEX or their nurse practitioner boards and go on to get that first job and continue in their career.
Wow, it seems like there's a lot that goes into it. Well, I really appreciate you taking the time to hear me out and hear my question, and thank you for your response.
Thanks, Maya. I really appreciate that. It was a really good question.
Yeah, I'm sure my classmates are going to be really happy to get a little insight on what's going on.
Absolutely.
Hi, my name is Kayla Cabana, and I'm really interested in pediatric oncology. I'm also very open to exploring other areas in nursing. I think about how the challenges in nursing today will shape how we learn and eventually practice. From your perspective, what do you see as the most pressing challenges facing nursing, both in education and in clinical practice?
Thanks, Kayla. Great question. We talked about two issues already today with regards to mental health and resiliency, and then also workplace conditions for nurses. I think there are a lot of other things that are happening in the healthcare industry that are impacting nursing today. Resources are a big one. So we've seen some changes around the financing of healthcare, whether it be through Medicare or Medicaid, with the result of some legislation that has been passed at the federal level. And that is going to have a trickle-down impact to health systems, which will impact nursing. Nursing is typically the largest labor cost of any health system. So when resources are tight, nurses typically feel it. And I think that's a real consideration for the time period that we're in as well. I think there are also just some other things happening in healthcare that are really, really driving nursing significantly forward in a way that we have to really keep our eyes on as a profession. And I'm referring to the use of artificial intelligence. There is a lot of promise in the way that we use artificial intelligence, whether it be in nursing education or nursing practice, but we also have to acknowledge that there's potential pitfalls. And I think it's really incumbent upon us as a profession, whether it be higher education or whether it be the practice profession, to make sure that we have a seat at the table and that our perspectives around the use of AI are being heard. And to make sure that we're thinking about it from an ethical perspective and away from, in keeping with our role as advocates to ensure that there's not a harm to patients, but that AI will be used in a way that augments their care. I also think it's important from a workforce perspective. We hear about how the use of AI can help nurses do their job. I want to make sure that AI doesn't then free up the space for nurses to have more on their plate. Right? I want to make sure that, yes, AI is used responsibly, but in a way that allows us to have time to do what we want, what we need to do, and that's engage with patients and families. So I think, AI right now is probably one of the biggest buzz topics that we're dealing with, and it has implications for how we teach nursing and how we practice nursing. I think the most important thing is that we need to inject ourselves into conversations around the use of AI and make sure we're sitting at every table that's discussing the use of AI in healthcare.
Thank you so much for taking the time to speak
You're
with me.
welcome.
Hi, my name is Gabriel, and I have an interest in ICU nursing. For my question, many people talk about a nursing shortage, but here in the Bay Area, it often seems more like a shortage of experienced nurses. From your perspective, how does this shape the challenges in nursing today, and how can nursing schools like USF help prepare students to bridge that experience gap?
Thanks, Gabe. You've really hit on a really important point that I think also relates back to some of the other things we've talked about this morning. We are seeing a loss of experienced nurses through retirement, through burnout, through some of the challenges that we talked about, and then we also see a loss of nurses in that 3 to 5 to 7 year range. Whether it be workforce conditions or expectation mismatch. But you're absolutely right. There is a loss of professional knowledge and professional experience here in the Bay Area and frankly across the nation when it comes to nursing. So we do have a bit of a challenge ahead of us in ensuring that we're preparing new nurses to step into roles that they may not have, had to step into immediately in years past. They might have been able to get a little bit more time under their belt, and all of a sudden, they're prematurely being placed in leadership roles. So I think for USF, the way we're approaching nursing education is to really make sure that we're educating the whole person. And I don't just mean from the cura personalis, mind, body, spirit, but really from all the skill sets that it takes to be a successful professional. So talked a little bit earlier about communication and conflict resolution. Really ensuring that our students come out not just knowing how to communicate with patients and families and other healthcare professionals, but how to communicate with colleagues, how to perhaps provide some corrective language, how to provide leadership in certain spaces. I think really emphasizing the leadership skills that are needed on a unit, wherever that may be, in whatever kind of setting. I also think it's not necessarily a bad thing to have turnover in a profession, right? Yes, we lose great experience and great knowledge, but let's be honest, we also lose folks who are pretty stuck in the ways of we always did it this way, right? And so I think there's an opportunity to ensure that we really are using the skills that you are using the skills that we've provided you around evidence-based practice, around assessing the current evidence, so that we can make sure that our patients are receiving up-to-date care, that we have a reason for why we do something this way, not simply because it was the way it was handed down to me by my preceptor and so forth. So I think that while it certainly is a challenge, there's a lot of opportunity to really lean into developing not just the registered nurse, but the nurse leader. Even at the baccalaureate level, you don't need a graduate degree to be a leader. I think there is a lot of reason to really double down on making sure all of our students really understand how to assess evidence-based the evidence base for their practice, and that's just, innate, that they ask that question, why am I doing what I'm doing? And then communication and conflict resolution. I think all of those areas are things that I hope, are focusing on at USF, but I also hope that just nursing in general as a profession is also focusing on those as well.
Yeah, thank you for that thoughtful response. It's definitely a lot to take in and consider. But thanks for taking the time coming out
Thanks,
here.
Gabe. Appreciate it.
And that is a wrap for today's episode. I just want to give a huge shout out and a huge thank you to our special guest, Dr. Eileen Frey-Bowers. Thank you so much for taking the time out of your day and joining us and sharing some insight about your career and things that are in store for the nursing program. So thank you so much for your time today.
My pleasure, Will.
And I have to ask, because all the students are just so curious to find out, but can you share us like a little update or just a little sneak peek about what are the building plans for this new building that USF bought? We've heard that the entire nursing department should move into there, and we're hearing that there's plans going underway. So we're also kind of curious, like, what's happening with that? Another cool little fun fact about it is I was just recently reading that the building was actually a former blood bank, and this blood bank was used during the AIDS and the HIV epidemic in San Francisco. So yeah, tell us a little bit more about the plans that are underway that we'll be seeing in the future.
Sure, happy to. So you're right, it was the Irwin Memorial Blood Bank, and it played a very pivotal role in the 1980s with the HIV epidemic. UCSF and Stanford both had research labs at it. So while it was a normal blood bank, it also had a research component to it. And then it also, in the 90s and early aughts, also did work around Ebola and so forth. So, it's really rather fitting that, once it was decommissioned as a blood bank, that it would continue to be in the healthcare space and provide a space for educating the health and life science students of the future. So we do have plans for the School of Nursing and Health Professions to move into the building when it is refurbished. The labs on the second floor are research labs, and those will be utilized by students in the College of Arts and Sciences. We are planning a new simulation center or immersive learning center. We really want to integrate more virtual reality, augmented reality, artificial intelligence, all of that technology to help our students learn in settings that feel more lifelike, so they're even better prepared to go out into the real world. As far as timeline, we recently had a change in leadership at the university, and when that happens, sometimes capital projects slow down a little bit. But I think, moving forward here, we'll start to see some more activity, and I don't have a timeline just yet. There's all those sort of city building permitting processes and things like that. Plus there's the fundraising. So we're, working on all of that and hoping that within the next couple of years, there'll be some really positive forward movement on, developing that building in the way that it will meet our needs. I think, I'm really proud of the fact that USF didn't just, level the building and start from scratch. We're adhering to our beliefs around sustainability and using something that existed and then refurbishing it for our purposes. So I think that's really important as well. But in the meantime, we're investing in our simulation center, in terms of the new mannequins, in terms of some of the other equipment that we've brought in to really support our learners' experiences. We have a brand new pediatric mannequin coming in. We just got a new baby. We just got a new birthing mom. So, we're not waiting for a new building to bring in new things to ensure that our students have the best possible learning opportunities.
No, that's really great. Thank you so much for sharing that with us. We're just all, as students in the cohort, we're just so curious, like what's happening with the new plans, and we all students, but we all love seeing new things being brought to the program, and we love seeing like the school investing into the program. So thank you so much for sharing with us. And for the rest of the episode, I just want to say thank you so much for sharing your time and your space for being here. It was really great getting to know you more. And other than that, thank you everyone for listening to today's episode, and we will see you guys on the next one.